Welcome to Medical News Network, your trusted source for the latest advancements in the medical and dental field, making your life better. I'm Mike Wittgenstein, and thanks for joining us. Today we brought our cameras back to the offices of a doctor we first visited with a few years ago to find out what's new in TMJ and sleep apnea, or the dysfunction of the jaw joint now known to cause headaches, migraine, neck pain, back pain, as well as a variety of other issues, and sleep apnea, or the stopping of breathing while you sleep, now related to high blood pressure, heart disease, and all too often, an untimely and all too soon death. So if you toss and turn at night, don't sleep well, have headaches, migraines, back pain, or maybe some condition that no other medical doctor has been able to explain to you, my advice, sit back, relax, get comfortable, and we'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're in the offices of Dr. Leonard Feld. First of all, Doc, thank you again for allowing us to bring our camera and crew out and for spending the time to educate us what's new in sleep apnea and TMJ. I asked you to have a few patients out. See, we had quite a few show up, so we're going to interview them and talk to them a little bit. But let's just get started with talking about the latest advancements in sleep. Now, if I told you before, I would never have thought to go to a dentist for sleep issues, for snoring or you know, any kind of conditions to deal with sleep. Tell me a little bit about it, what it is that you do for sleep.
Well, we first try and diagnose the patient. We do testing. We monitor the patient, and we do what's called a polysomnogram, sometimes in the hospital and sometimes a study is done at home.
Now you have mobile sleep studies that you actually send people home with from here, for those
Yes.
that don't want to go
to the hospital.
Right.
Well, we found that most of the people, 90% of the people that have problems breathing are not diagnosed because they don't think it's a problem or they don't even know it's a problem. And so when we're fortunate because most patients see their dentist more than they do their physician. And so a dentist has a chance to take a look at the signs in the mouth for these particular issues because they can come out in the mouth by virtue of how the body reacts to it.
So are you telling me that 90% of the people with sleep issues either don't get diagnosed or don't know they have them?
Right.
So what would be some signs? I mean, obviously, and I asked you about this before, obviously if I have a big bruise in the middle of my back from somebody hitting me with an elbow because I snore all night, might be a symptom. But is there other things? Are there fatigue, tired? I mean, does it affect kids? What is it that you would be looking for?
It can start at a very young age. Grinding of the teeth is a real good one with children, and they start gnashing their teeth at night. It's usually an issue of breathing.
Well, I've had friends that say they grind their teeth and they get an appliance to stop them from grinding their teeth, but they never mentioned they had any problems with breathing. They just said their dentist gave them an appliance to protect their teeth.
Well, in dental school, for years, they've taught to put an appliance to protect the teeth because dentists protect teeth or work on teeth, and that's what dentists do. So they make these things to protect the teeth. But the question is, why are the patients grinding? Why are they grinding instead of let's protect the teeth? And it's usually an issue of an interference, a malocclusion, a bite problem, a jaw joint problem, a positioning problem, causes this trying to get the bump out of the road, you know, trying to make it smooth. Or a position where someone has some pain subconsciously in a level that they don't know they have pain, and they just, oh, that feels better. So they push on the teeth, but they don't know they're doing that. And it's usually at night when they're relaxed, when the systems of the brain work differently than the ones during the daytime. We have basically two different systems. The systems are the parasympathetic and the sympathetic. And the parasympathetic, it's a big word, but that's the part of the brain that works at night to try and keep you alive. And when there's a function or an interference with a function of the body, then usually what happens is the part of the brain which is called the sympathetic system takes over and starts working at nighttime to try and keep a person alive. And that's where the fatigue sets in, irritable bowel syndrome, autoimmune disorders we found. And of course, if a person wakes up with a headache, then they've been working all night.
Clenching their teeth.
Clenching their teeth.
So if you clench your teeth, it's probably a good sign something's wrong.
It's not normal.
Now, you said 90% of the people go undiagnosed.
Right.
It's my understanding, and this may be, and we're going to get into this real quick with what you do for sleep apnea, because what you do is a little different than what is normally done. It's my understanding, if I go to a medical doctor or a sleep clinic for sleep apnea, and you have two wonderful examples here, I'm going to get what was commonly called a CPAP mask. Was anybody know anybody that got diagnosed for sleep? Is this what they get? Yeah, what'd you get? Everybody gets the same thing. It's not like there's even a choice. So if this is the choice, then why would I go get diagnosed if I'm not even going to wear it? If I know this is what I'm getting, why would I? So what is it that you do? How do you treat sleep? Because I know we've had a couple patients here that you've treated for sleep. What is it that you do for sleep apnea that's different than this?
Well, we try and find out if there is a sleep issue and what it is. If it's a central issue, or is it, where their sleep problems are. What's interesting is the tongue is attached to the jaw. And if the jaw didn't grow properly, or there's no room for the tongue has to go somewhere. And you don't really see, like a dog, you don't see humans kind of
Hanging their tongue out, right.
Right. So usually what happens, and especially at night when you relax, the tongue goes back. Where's it going to go? It can only go backwards. It's pretty hard to go forward. And there's no room for it. And in some patients, you'll actually see little indentations in their tongue from the tongue trying to get out of that space back there, because
Those little scallop marks you see on the edge of the tongue sometimes.
Right. And so that's a sign, and dentists should, when they see that, they should say, oh, you've got problems breathing, or the tongue's in the way. Then tongue might be too big for the mouth. Well, why is it too big for the mouth? Because the tongue is not too big for the mouth is too small for the tongue. So you do some expansion, appliances, you can move the teeth and the jaw out to create room for the tongue, and that usually stops the problem. Well, first, what we do is, you have to understand that mask is called the standard of care, and that's been used for years. And the challenge with this is that we have found statistically that 92% of the people that have these are not wearing them after 6 months.
The CPAP.
Right.
Okay.
So what we do is we use what's called jaw advancement.
Okay.
We have appliances we put in the mouth, and we take x-rays of the mouth and jaw, and we find different ways of doing it by moving the lower jaw forward. Now remember, I was talking about the tongue being attached to the jaw. So if we move the jaw by putting a little appliance in your mouth, and there's different kinds of them, we have all kinds of them. What we do differently than most people is, we've been working with a single one. So all they do is put this little plastic thing in their mouth upstairs while they sleep at night, and that keeps the jaw from going backwards, creates a space so they can breathe.
Okay, now I'm going to talk to you for a second, but before we do, this picture you're telling me shows the airway, right?
Right. This is a cone beam picture that is taken of the patient.
So this would be the neck.
Yeah, and you notice also the neck is straight, which is not normal. And it's straight, it's supposed to be curved, and it's straight because the person is being moved forward by the brain because it's trying to get air. And you can see here, this is the outline of the tongue pushing against the airway. The white here has been stained so you can see the airway. And this is volumetric.
And this is what he breathes through.
This little piece here.
Okay.
Can you imagine now that patient lying down and the tongue going even further back because of gravity? This is even going to get smaller. So now what we do, and rightfully so, you got to get some air. So we blow a reverse vacuum cleaner down their throat. Right, the CPAP, which pushes air through a machine through this to try and force it down this little tube.
Okay.
So now this other x-ray shows in volumetric that once we move the jaw forward, that the tube expands,
Because
and now naturally
you don't have the tongue pushing back in on it.
right, and so now naturally you get air without having to shove it down your throat.
Okay, I want to talk. You told me that you came in originally to see Dr. Feld because you had jaw pain or popping.
Correctly, yes.
Okay.
Really bad.
And then you proceeded to tell me that you were sleeping, the bags under your eyes were going away, that you were scheduled. Did you notice that big a difference with just a little, and I hate to call it a little piece of plastic, but basically that's all it is.
Yes, there was a big difference. I've only been with the appliance going on, I believe this is my 4th week, and I noticed a big difference. Beforehand, I was only getting like 3 hours of sleep at the most. Now, I'm getting my 8 hours sleep. There's a big difference.
Do the people around you notice a personality difference? Because you seem, I don't know if maybe you're always this way, but you seem pretty jovial since I've had the pleasure of meeting you. Is it?
Yes, I've basically been that way my whole life, you know, but
You weren't when you came in.
no, in fact, my wife says you're becoming your old self again. You know, she's noticed it, and my other friends have noticed it too. You know, they said you're talking with a lisp though. You know, but hey, it's worth it with the appliance. I know it's going to go away. There's other people here that I know it's just getting used to it, but I've noticed a big difference. You know, even in
How hard is it to wear the appliance? I mean, is it cumbersome or?
it. You know, my first day was just getting used to it, but once you're used to it, there's you know you
Are
really.
you wearing an appliance right now?
Yes, I am. I'm a firm believer in it. In fact, when I take it out, I clean it up and I put my night one to go to sleep. You know.
Did you had a sleep issue too, right? And you were one that said, I didn't even know I had a sleep issue.
I didn't know I had a sleep problem. No.
Did you know, have you noticed a difference with the appliance?
Absolutely. Deep sleeps with great dreams. Yep.
Now you mentioned dreams. Had you, things I pick up on. I do this all over the country, and a lot of people tell me they don't remember they lost their dreams, and all of a sudden they're dreaming again. Is that are you having?
Right, and I remember most of them too.
Well, that's a good sign.
Yeah.
And same for you, the appliance, you get used to it? It's not too cumbersome?
You get used to it. Yes, you definitely get used to it.
We have a lot of people that are not. He's not overweight. He's right within the body mass index and the neck and everything else. He's got the neck of a woman.
And you still had
I had big sleep problems. I didn't realize it, but I did.
So I'm gonna ask you to repeat that because I don't know if I heard it.
I had very dramatic sleep problems, but I was not aware of it until I did a sleep study. And then after the device, I slept so much better, and I'm still sleeping better, and it's continuing to improve over the number of months that I've had the device.
Now, are you wearing your device?
I'm currently wearing the device, but I'm weaning off of the device during the day.
Should be on your night one. All right, don't mean to push everybody along, but we do need to get along here, and I want to talk a little bit about TMJ. So, let's start with here. Tell me, what is TMJ? What is it? What's it control? We're going to get back to you, don't worry, because I'm going to get you popping on your jaw. But go ahead, start with...
It stands for temporomandibular joint. The temporal bone is the skull.
Okay.
And the part of the skull that houses the ear and the jaw that moves.
Which is right here.
Right. There's a disc, a piece of cartilage, where you're going to see in a moment, that sits on top of this bone. And it's tied to this bone on the skull. The jaw moves in and out like this. We're not chipmunks. We don't chew at just a straight pace. We actually move. The jaw slides and moves, and everybody knows here it can move sideways, up and down, in and out. And you can't do that with any other joint. Can it get sprained? Can it move? Absolutely.
But it has a lot of movements that a normal joint.
There is no other joint in the body that moves in all three planes.
So it's not like my knee or my elbow or my finger.
No, they call that a dislocated knee or a
Right,
broken-
if it came out.
Yeah.
Okay.
And then all of a sudden you have
And
an
this
operation.
is just the ear canal?
That's your ear.
And the muscles that, I guess, open
These
it
are the
up.
muscles that pull it forward. And what's interesting, the muscles that open the mouth are attached to the jaw and this piece of cartilage that are up here. And it keeps it moving together. In order to close the mouth, it's an entirely different set of muscles, has nothing to do with this mechanism. So the muscles that open the mouth are attached in front here, and they move the jaw this way. Now, in order to get it back, you have the outside, you have your biceps out here that move it closed,
And then pull it back.
which is not attached to this. So if there's something wrong here, and we'll show you what's happening, and what happens if there's something that's a challenge with this, then the body adapts to it somehow.
Okay.
Oh, here you go. Now we've taken the ligaments away. Now we're going inside, and now you can see the jaw in cross section. This is the jaw that moves. So here's the temporal bone, which houses the ear and the jaw joint. This is a mandible, temporal mandibular joint. So this space here is a joint, like the elbow joint, except it's a little bit more complicated. Here are the muscles that attach to the disc or the piece of cartilage and the jaw. And that moves it this way. Now, if there's some sort of what you were alluding to, I think, a displacement of this disc, then it's moved in a different place. But I think the next slide here shows the jaw actually moving with the disc in place.
So the disc stays on top of the jawbone, act like a little slider, a little glider.
It's kind of like a pillow in between the two bones. Guys would think like a gasket or a protector between the two bones, because you don't want the bones to rub against each other. I think they call that arthritis.
Okay. So what happens?
Well, if it stays off, since there's nothing pulling it back, because the biceps close the mouth, there's nothing pulling this
So there's
cartilage.
no muscle attached to that. That's just attached to a ligament that's pulled back. like a
No,
rubber
it's
band?
attached to a muscle to go
Forward, but nothing to pull it back.
Nothing to pull it
Just the
backwards.
little ligament that holds
Right.
it.
So if the ligaments, you get a sprained ankle, you don't have a broken leg.
No.
So if you sprain the ligaments here, and they're stretched somehow,
So is this where people start to develop popping?
you're right, because now it's popping on and off, because the jaw now moves this way, and this is in front, right? So it's in front, and so the jaw now moves forward, okay, and sometimes this pops back on.
And
Pop.
Then so you hear the popping.
Right, and then it slides off again because it
So
doesn't have the
is
staying
jaw
power.
popping always a sign something's not right?
What's a sign that the disc, we call it the disc, the cartilage is moving?
And that's
I don't know, it's not a good sign. Does it mean that you're going to have pathology? Not necessarily, because it might just stay in that position.
right.
But do we have a good chance of it getting worse? Yes.
How many people had jaw popping? I know a few of you did.
Oh, wow.
I want to ask you about it because you sing.
As a hobby.
So tell me what happened.
I had a problem with getting my jaw loose enough and to drop enough so that I could get the sound out. And after concerts, I would be just aching in pain for days, just mostly on one side, because of all the straining I was doing. And besides that, I was always tired. I couldn't sleep, so it was the whole package. And with the appliances, like my jaw is dropped, it's in a better position. I can sleep better.
Does it hurt after you get done singing anymore?
No.
So you've noticed a dramatic
Oh, yeah.
difference.
Yes.
And you had that problem for a while
Oh, yes. Many, many years.
and just learned to deal with it.
Basically, yes. Taking over-the-counter medication and hoping that it would work.
And you had a popping jaw too,
Yes, I did.
and had it for a long time, or just
A long time, and then it got to the point where I couldn't open my mouth, and then when I did, it would lock out of position, and I'd have to move it back in. I couldn't even open my mouth to brush my teeth. It was that bad when I finally got to see Dr. Feld.
and how are you now?
Wonderful. Absolutely a miracle. Yep.
So now you've had the appliance in, mouth is good, no more popping?
No more popping. I can open my mouth. I can eat just about anything but nuts. And doing great. Absolutely great. I'm in phase 2. I got my appliance on Thursday, and it's just phenomenal.
Now, did you say you didn't have any popping?
Not popping.
Other
Symptoms.
what did you have going
My
on?
symptoms is tightness in the jaw and just brain fog and discomfort all the time and just couldn't sleep real well. And yeah, that's what I had. It was really painful, and I had it for years and years and years. I went to several different chiropractors, and nothing helps. So it's difficult, but I'm thankful. And now my daughter's going to start too.
This is what happens if it doesn't get treated over time.
Right.
And that's what you talked about, arthritis.
Or
But
osteodegeneration.
I want to get to a couple things that I think are really important, because right here, this little piece that you see right here,
Right.
through that little piece, and the reason all these people had these problems that for some reason were miraculously changed when you move that jawbone forward. You're telling me go all these nerves, blood vessels,
Well, this guy seems to think so.
yeah. Well, I mean, it shows that there's your ear,
Yeah.
and you're telling me there's the jawbone, and it looks like all that stuff goes right through there. Because it wouldn't make any sense to me how moving my jawbone could get rid of my headaches, except headaches are blood, and if the jawbone's pinching it, you have a slide here for that.
Right.
Okay. The nerves, if you're standing on my toe, it hurts like crazy. If you take off your foot off my toe, it doesn't hurt so much anymore. Well, if the jawbone's pushing on those nerves,
It's going to
you get
create
that
a problem
pain.
somewhere.
Somebody, you had the shoulder
Right.
that was sloping off. Just real quick.
Right.
You had the shoulder you said was way,
Was sloping, yes, very sloped shoulder. I couldn't even wear my my shoulder bag. It'd fall right off.
and I was telling you, I meet a lot of women that they say that bra strap falls off on one side. Why would
Well,
that?
be careful.
Why would that have anything to do with their jaw placement?
Well, you can see there that those nerves and blood vessels go through there. And basically, if the jaw moves backwards, because that little cartilage is forward, remember, it got pulled forward, and if it moves forward by just natural, you saw that picture, if you want to go back, you see the jaw now goes backwards because this little cartilage is forward. And if it goes backwards, then it can impinge or press on the nerves and blood vessels go through there, okay? So you're asking me about the shoulder. Well, what happens is naturally we always run away from pain or any kind of disaster. No one stays in a building that's on fire. We go away from problems. And the brain is no different. So what happens is if there's a problem over here, then the brain says, well, if you move over a little bit, if we drop the shoulder down a little bit, of course the brain doesn't say that, but it's a reaction, it's all reflex because we're trying to breathe and get rid of this problem. So if it's a breathing problem, you're going to adapt to it. If it's a problem of function of something happening with your brain and saying, you know, I can't think of all this other stuff, but you know, I know that if, oh yeah, that's a lot better. Oh, now I'm over here now, and that's a lot better now because I'm away from the problem of this pinching these nerves and blood vessels.
And
That
then,
make
of
sense?
course, your hips would just naturally balance, trying to keep you from falling over.
I think it was about 100 years ago, someone wrote a song called "The Head Bone Connected to the Neck
Well,
Bone."
but you were scheduled for back surgery,
Yes.
and you were on some drugs that I couldn't even say the names.
Scalaxin, Norco, and Oxycontin.
And you're off those now,
Yes.
and you haven't had your back surgery.
Right.
How's your back feel?
Great.
Do you see that a lot? You get this straightened out, and other symptoms start going away.
Yes, that's what we do. We seem to have an incredible amount of change in other functions of the body because when the brain is relieved, it now can go back to what it's supposed to be doing, keeping you alive.
Okay, last one, and again, we're out of time. We have to go. This I want you to explain real quick because this explains headaches, migraines, blood flow.
Well,
Same-
you had the
same joint,
picture of all these blood vessels going through
right?
this area here, right? Now, follow this again. The little cartilage slips forward, right? So now the cartilage is supposed to stay on top of the jaw as it moves. Muscles pull it forward, pull the jaw forward and the disc or the cartilage, okay? Now the other muscles back here pull the whole mechanism backwards. forward, back. If this little cartilage slips off and is no longer where it is it logical that this can go into a different place because it doesn't have the little pillow on top?
Well, it also wouldn't have it there to stop it if it was pulling backwards. It would just pull it back as far as it could get it to go.
Right, exactly. Very good. So as it goes all the way backwards, all those nerves that you had there, and blood vessels and everything, that mess of stuff that goes through there, if it goes back there, the question is, could it impinge or pinch these other vessels and nerves? And what this picture shows is, yeah, if this little cartilage is off and the jaw goes backwards, do you see that this could now pinch off these nerves and vessels? This shows the external carotid artery, which is a pretty important thing to go to the brain, which sends all the blood to the brain. And so now if you have less oxygen going to the brain and to the muscles of the head by virtue that this jaw is in the wrong place, okay? Do you think that might give the muscles a problem of the head and the blood flow and have less oxygen? Yeah, it seems that way. And with that happening, the muscles don't get enough oxygen, and you get a buildup of what's called lactic acid and the flow, and you get a lessening effect of oxygen to these things. And a headache is nothing more screaming out of, I need some air.
From the brain.
Right.
Okay, don't mean to cut you off, but we are completely out of time. If somebody has questions, concerns, something we haven't dealt with today or touched on, they can call your office?
Of course they can.
Okay, well.
Yeah, that's why we're here. We're here to
web-
spread the message with patients that have had the treatment. And we have a website. It's called DocFeld.
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 .com.
.com. Yeah.
And they can visit there.
You could visit there. We also have a network of other individuals that we've created around the country called the ITSMN.
So people that, because we're in the desert here, so people that are visiting here, even though they may get started here, you can tell them there are other places or people in the country they can see when they go home.
Yeah, because I'm in the desert, we've had to create a network across the United States and Canada because I have a lot of patients that come here from Canada. So now we've started training other doctors in other areas so that they can go if they need help in other areas.
All right. Well, again, thank you for taking the time with us. Anybody has any concerns or questions, obviously they can call you and see if they can get themselves better. You've been watching Medical News Network. I'm Mike Wiggenstein. For any information on this subject or any others, please visit our website at medicalnewsnetwork.info. Until next time, I wish you good health.